Hi, my name is Kennedy Sexton, and today I'm going to be demonstrating performing a psychosocial assessment on my patient. I'll make sure to follow all GPSP during this procedure and ensure client safety. I would also avoid non-therapeutic techniques such as minimizing, giving advice, or changing the subject during this procedure and assessment. I will pay close attention to my client during this assessment and respond appropriately, focusing on intentional, goal-oriented conversation. I'll begin by knocking, entering, and introducing myself to my patient, as well as performing hand hygiene. Hi, my name is Kennedy, and I'm going to be your nurse today. Can you please tell me your name and date of birth?
Brandon Rains, 8/20/1998.
Can I see your wristband? Thank you. I'm here to ask you a few questions so I can get to know you better. Is that okay with you?
Yes, that's okay.
Perfect. We'll go ahead and get started. All right, since my patient is sitting down, I'm also going to sit down and get on their level. This just helps to maintain eye contact, meeting them on their level, and showing them active listening and attending. We want to build trust with our clients, and we want him to feel safe, so he'll share information with me. To begin, can you tell me where we are and what day it is?
Yes, we are UK KDMC on the mental health unit. It's Saturday, March 21st, 2026.
Okay, now that I know my patient is oriented to where we are in the time, I would now take vital signs if necessary, and during this whole assessment, I would assess my patient's appearance, their affect, and their body language. I would focus on their hygiene. They appear well-groomed. They're dressed for the season. They have no abnormal body odors that I can note. Their skin is warm and dry. I see no marks on the exposed skin. They're maintaining eye contact with me when appropriate, and I would also focus on looking at their eye contact during this the rest of this assessment. And I can see that they seem a bit flat, but they're not fidgety or shaky at this time. They're speaking at a normal rate. Their tone is a little bit flat, but their speech is coherent overall. I'm also assessing their mood. They don't appear to be angry or fearful. They just pretty much seem glum and flat. They're acting appropriately for the situation at hand, and they're alert and oriented ×4. So I'd make sure to keep these things in mind as we continue the assessment. Okay, great. Now, can you tell me a little bit why you're being seen today?
Yes, I've been dealing with some depression and suicidal thoughts.
Okay, can you tell me around the time these thoughts first started?
About a week ago, I've dealt with depression since I was a teenager, but my thoughts have been more intense this past week.
Okay, do you have any thoughts of harming yourself or others right now?
No, I feel as though my thoughts are more rational today than they have been compared to the last few days.
That's good. Have you ever harmed yourself before?
No.
Okay. And are you seeing or hearing things that you believe others are not?
No.
Okay. And do you take any daily medications?
Yes, I take 40 milligrams of Prozac daily.
Okay. Do you take anything over the counter?
No.
Okay. And can you tell me a little bit about where you're from?
I'm from Louisa, Kentucky. It's a pretty small town.
And do you live alone?
I live with my family. It's me, my mom, dad, and sister.
Great. Can you tell me a little bit more about them and your support system?
Yes, I rely mostly on my family and friends. Me and my mom are pretty close.
That's great. Do you feel safe in your home?
Yes.
Awesome. Can you tell me more about what a normal day looks like to you? Do you have any hobbies?
I mostly just work and come home. I like to read and watch TV when I have time. I just feel stuck most days, like I'm just going through the motions.
Is there anything specific that you notice seems to upset you?
No, I just feel like I can't find enjoyment in my day-to-day life anymore, and I tend to take it out on those around me, isolating and hiding.
I understand. It seems like you're going through a lot. I understand how difficult that may be for you. Is there anything that seems to take your mind off of things?
I like to take my dog out on walks when the weather's nice.
That's great. Can you tell me more about how that makes you feel?
It's nice to get a change of scenery. I feel so lost in my own mind sometimes. It helps to focus on someone or something to get it out of my own head.
I understand. Thank you for answering honestly. Do you have any other questions for me right now?
No, I don't think so.
Okay, that's all the questions I have for you. Is there anything that you need at this time?
No, thank you.
Okay, thank you for your time. And this would conclude my initial patient interview. At this time, I would perform hand hygiene upon leaving the room and document my assessment immediately. So we can note from this assessment that he shown a little bit of displacement with taking out his feelings on his family in the form of isolating and just taking time for himself. I can sense some guilt around that. Overall, he just seems flat and a little bit glum. His tone is flat as well, and it is coherent as well as his speech. And that is all makes sense with the depression and the thoughts that he came to us with. So again, I would document my assessment immediately and report and record. Thank you.